I'm Emily Gockel, and this is Korthanke.
And we are Women's Health Ambassadors for the St. Francis Gala.
So I work for the Women's Health Clinic. I'm the new OB nurse, as well as see patients at 28 weeks and 36 weeks to do their pre-admission. I also see newborns right after delivery up in the inpatient area, as well as see them for lactation visits to do weighted feeds. I can also follow up with moms postpartum. When they see me for the first time with their newborn to help with breastfeeding, I follow up with mom for like postpartum depression to see how just general life stuff is going.
So I'm primarily an OB-RN at this point. So I just do a lot of like couplet care and inpatient labor and delivery, but I also do inpatient lactation as well. Primarily that's all I do for now in terms of lactation, and then also help with some Mothering Mondays and teach some childbirth classes as well. Numerous studies have shown that having an IBCLC for lactation support is crucial, that it does increase breastfeeding rates, it does increase the chances of being successful in your breastfeeding relationship. And so we have two IBCLCs on staff, both Emily and I. And I just feel like, between seeing them for breastfeeding education prenatally to set them up on the right start, to having those, the postpartum inpatient lactation support, to the Mothering Mondays, I just feel like that is so important, not because we want to force any kind of feeding decisions on you, but because we want to support all the moms and their feeding plans, whatever that is, whatever that looks like. That's what we're here for. And I think that's really important. I think it's really important for mom-baby bonding. It's important for baby's health. It's important to help mom feel successful and like she met her goals that she set for herself.
So Mothering Mondays is really good for moms once they've really got established. I hear a lot of moms at Mothering Mondays say how it's just a nice for them to get out and about with their baby, especially during the winter months when they feel like they're stuck at home. Also, if that postpartum is hitting and they feel like they're alone in this journey, it's a really good way for moms to connect with other moms. Some days we go and we talk about breastfeeding, how the babies are doing, and sometimes we just talk about life. And I hear a lot of the comments saying, okay, well now I don't really feel like I'm the only one. So it is a big deal. The space is wonderful that we have. I feel like I see pretty much regular people. Some people come religiously every Monday. Some will hit Mondays here and there. And I think the nice thing about it is it's kind of come and go as you want. It's not I have to sign up, I have to pay for this. It's very just open to the public. Anybody who wants, like Caitlin was saying, it's basically if you can get a hold of it and figure out where it is and what we're doing, there's lots of people that come. I have 10 to 15 people at times that come.
The opportunities for education throughout. So you see them new OB education for their pregnancy, 28-week appointment education for like what to expect for the third trimester, and breastfeeding, ordering a breast pump, things like that. And then pre-admission appointment, what to expect for childbirth, what to expect for the first couple days breastfeeding. And for us working in inpatient, like that really sets them up. We've seen that it sets them up for a really good start for breastfeeding from there on out.
And I do feel like they feel more comfortable, especially towards the end of pregnancy. And then when they're coming back for those intimate appointments with breastfeeding, they are more comfortable asking you those questions already. Things get a lot deeper with conversation, and they're definitely more comfortable to tell you things. They might not even tell their provider, because sometimes the provider's in and out pretty quick on those short OB appointments. I get a whole hour with them when they do a lactation appointment. And sometimes it isn't all about baby. If baby's doing great, sometimes mom just talks to me about how she's feeling as well. So one of the big parts here of trying to put it all together is patients see me at the very beginning of their pregnancy, as well as all the way through their pregnancy. So I feel like it's nice to go the extra mile by seeing a familiar face every single visit almost. And then they're the first one I typically see once they've left the hospital and then come back. So I feel like they're really comfortable after seeing that same person over and over again. It's very down to earth here. We try to give everybody, I feel like, exactly the birth plan that they want, with obviously for their safety or, things like that. But I mean, I don't know. I just feel like it's more homey here. It's more patient-centered than it is as being a number shuffled through the OB department. And I feel like it starts when they see me every time in the clinic, and then they'll take a tour and they might see Caitlin's face at the childbirth education, and then they see her again at delivery, or maybe they don't see her at delivery, but they delivered on a Friday and then they see her Saturday. A lot of our nurses will see them for their non-stress test, and it's the same nurses. It's not like we have a ton of employees, so you see that same face over and over again. I feel like patients end up being more like friends than they are patients a lot of times.
Definitely. And then, and then they'll follow up with her for a lactation appointment, and then they'll come to Mothering Mondays. And there's that continuation of care that also it's a part of, I feel like a part of our community and a part of what makes us special. And I feel like a part of what brings in a lot of people here is seeing that familiar face, the consistent, competent, compassionate care. And
I feel like there's a lot of people that in the community, that we are a small community, that people are scared to come here because friends and family work here. And I totally understand that, keeping business and pleasure separated. But I've had so many friends tell me, I was terrified for you to be my nurse or help me with breastfeeding. And then at the end of it, they're like, I'm so glad it was you because I knew you had my best interest at heart. And that's completely it. We go as far as above and beyond to somebody stops you in Walmart. And you're going to help somebody because, like Caitlin said, it's not a 9-to-5 job. It's baby needs help now. That's when you have to help them. So, outside in the community, you see somebody at the county fair, you see somebody at Hype Nutrition, or whatever. You see them, and you're answering questions for them all the time.
We do get patients that come from other facilities. They've given birth at another facility because of whatever reason, either they're higher risk or it's closer in proximity to their home. But we still see them because we want to offer services for anyone who needs them. And I think that's another way that we go above and beyond. I think that supporting women and the maternal baby dyad, I think, is extremely important for the entire community, for everyone. Supporting women throughout their lifespan. And so I think, if I were to dream really, really big, if I were to talk about what I envision for this space, it's a space that women feel comfortable, supported, and that they can go and receive care from all the way from the very beginning, lactation support for babies, throughout pregnancy, throughout menopause.
My big hope, honestly, would be for somebody out in the community to have a space they felt comfortable to come if they needed to nurse or pump on a hot summer day. If they're at the park but they don't feel comfortable nursing their baby, somewhere they could actually just walk in and feel comfortable. Nothing huge, but just a warm, homey place that would kind of feel really comfortable doing that. I really would like to have our employees have a place that they can kind of call their own to feel comfortable in. I had employees be nervous about coming back to work because they weren't sure where they're going to pump at or what they were going to do. And I'm like, you should never be nervous to come back to your job and decide whether your baby should still be nursing or pumping or exactly what you're going to have to do. So my hopes would be just to grow what we can offer to them.
And then there's other services, I feel like that could make this Women's Health Center huge, like pelvic support therapy, a really nice procedure room that was very women-centered, that was focused on making women feel comfortable, because there's a lot that happens in a woman's journey with healthcare that is not comfortable. And when you have sympathetic and empathetic providers that have been on this journey before, that understand you, that care about you, I think we have this real opportunity to be just kind of state of the art and really, really important for our community.
I think you want women to walk in here and not feel like you're walking into a doctor's office. I think it'd be nice for them to walk in and feel like I really feel at home here. And I do feel like we do a great job with our staff and relationships. I feel like we just need the facility and the space and to kind of catch up to all of what we do, because we do an amazing job of supporting women, informing women. We just need the space and the update to kind of make that feel complete.